from health and an economic point of view. We have data. I will begin with the data provided by the Ministry of Finance in Cameroon. We have the reduction of 52% of the workers in Cameroon, which is a disaster. The production collapsed of 62.8%. The demand also fell to 52%. Now, in companies, the negative influence of the restrictive measures is up to 90%. This shows you the current situation of Cameroon. We also have a survey conducted by the GITAN, according to which 44% of the companies declared are deeply affected by the pandemics. Now, regarding the big companies, 62%, for SMEs, 38%, 56% for the industrial companies, and for service companies, 38%. That are affected, seriously affected by the pandemic. Now, we have also considered the other negative impacts of COVID-19, like their partnership between customers and supplier in terms of non-respect of delivery deadlines. Another impact is the price rise on the market as a consequence of the implementation of social distancing measures, closing of borders, because some neighboring countries of Cameroon have closed their borders, and like in such conditions it was impossible to sell or to trade with those countries. We also have the growth of the public and private debt in order to respond to the pandemic generated situations. The strategies of organization of commercial activities in the implementation of the COVID-19 pandemics measures. We've seen the apparition of innovative situations like the online trading. We also have the creation of startups in this strategy of online business. Delivery of distance or online services like the e-commerce, e-banking, and so on and so forth. Another innovative solution is the network marketing, the community economic system that was developed through the strengthening and establishment of local social and economic networks. We also have the group trade, the pooling of commercial initiatives through cooperatives, strategies of organization of the chain supply. For this, we need to monitor the inventory of the supply to companies and have a better stock management. Another strategy is to guarantee the relationship with the market in order to strengthen the social and economic bonds that were broken due to the outbreak of the pandemic. Reinforce the relation with the suppliers. It is important because if we don't have this, then there is no assurance that we have the product in due time. I have a couple of recommendations. First, develop a strategic partnership approach with multiple actors. That is district, finance entities. So in this, the districts have to stand as the guarantee and in charge of searching actors and managers in their territories with assurance. We also have the valorization of assets so that each country's potential will be valorized. We have our respective commodities like timber. In my district, we have a big forest, so we can develop partnership in the exploitation of timber, but also exploitation of other commodities that can be found in the forest, commodities that are likely to bring significant income, to generate significant income. These are internal solutions to each country. Another recommendation is to improve the companies' funding mechanisms in order to have a better response to the impact of the pandemic. I'm referring here to mechanisms like the self-funding in the case of cooperatives or other funding mechanisms. We should also promote social innovation in order to better respond to the needs of the population, like the project of fight against the spread of the pandemic. We also conducted an experience with the support of the District of Paris, the IMF, where at the pinpoint of the COVID-19 crisis, we have obtained the assistance of the IMF, whereby various cooperatives have made face masks, hand sanitizers, and this production was offered to 50 districts in 6 regions of Cameroon. It was a good experience, and I think it would be good to replicate them. We also need to promote the development of service, high value, high added value services, spread social innovations so that they are accepted by the populations. The population, as you know it, do not easily and immediately accept all the innovations. So it takes some time to make them accept any innovation. This is where we stop, and thank you for your attention. Thank you so much, Madam Mayor. The data related to the impact of the COVID are very important. When we see the impact on the activity, the industry, commerce, it shows how resilient Africa has been. We also have the role of social and solidarity economy, which is an economy that is very based on social and that is more resilient to economic shock compared to others. And this is certainly why we are still in the proportions that can be handled. It is also interesting to see that once there is an issue, then we have all sorts of a reaction, like the creation of startups and other initiatives. This is something we can capitalize and share with the actors in the OEDP network. Once again, thank you, Madam Mayor, for your interesting contribution. Now, Mrs. OUEHI, you are in the heart of the topic because you are leader of an association of producers. How did you feel this COVID-19 pandemic, and how did it affect the activities in your sector? Thank you, Mr. Moderator. First of all, I want to say thank you to OIDP and to its chairperson for having me on this panel, and I humbly appreciate my participation as a panelist. It is true that the topic is impact of COVID-19 on the commercial activities in urban areas. It is a topic that is relevant for all the traders like myself. But I will focus on the business of vegetables. It is true that the pandemic appeared in 2019, but in Côte d'Ivoire we saw the first cases in mid-March 2019, and the government took immediate measures, measures like the implementation of a curfew, the control and closing of borders, the control of movement of people in and out of Abidjan, the closing of restaurants, bars, dancing bars, schools and universities. We can say that these measures have strongly impacted the commercial activities, more specifically the business of vegetables.
Donc lorsqu'il y a eu cette pandémie,
when the pandemic started, markets brought the contribution to the effort made by the government by promoting the use of hand sanitizers and using of face masks, as well as application of social distancing measures. In our markets, we had to close markets from time to time, and this was implemented for 1 month. The traders were also compelled to modify and adapt their working program, because as operators in the sector of vegetables, you know, if I take tomatoes for example, if one tomato is affected, the quality of the others will also be contaminated. So during the pandemic, what we did was to impose on the traders to work with one person only in order to comply with the social distancing measures. There was also a mechanism of rotation of traders. On one table we have only one seller, and they went to the market based on a program according to which the sellers would go to the market in groups, so that we don't have too many sellers at the same time in the market. And this program was the closing of markets at 4 p.m. as requested by the mayor's office. It wasn't difficult, it wasn't easy at all, because our sector has been severely impacted by all these things. Measures like quarantining the district of Abidjan. This has partly interrupted the supply chain, because there was no more product coming in Abidjan. Since no truck was coming in Abidjan anymore, and since the Grand Abidjan, it wasn't possible to move out of the Grand Abidjan to the other cities, the result was price increase on the market. Now, social distancing and closing of market at 4 p.m. were measures that were implemented. And given the difficulties, caused by these measures. Some sellers just decided to stop their business because they couldn't continue in those conditions. The customers, the number of customers also decreased. It was difficult for sellers to continue their business because there was fewer and fewer customers. There was also one seller, at least one seller per market underwent significant losses. You know, tomato was coming from Burkina, onion was supplied to the local market from Niger. So the closing of borders affected the supply in those commodities.
Ils étaient obligés d'utiliser des moyens peu.
So we had to use untraditional means to supply it. What do I mean by that? We are all based in Abidjan, even though we say that borders were closed. Well, people managed to, let's say, go through the cracks of the, so they were doing that to feed Ivorian population, but also to take care of their family. If you stay at home jobless, how will you take care of your family? So that is why people smuggled goods. So when they go, for instance, you pay me 200,000 for the few. You don't sell to lose. She has to increase price in the market. So that's the problem. And we are foodstuff traders. You know that as a result of the closure of restaurants and catering facilities, you see that it has affected our turnover, because restaurants, they come and pay vegetables and the tubers, all these products from me. Now, if they have stopped their activity, it means that this is going to be a loss of earning. So the mayor office, since he's the chairperson of OIGP, I would like to seize this opportunity to thank the Honorable Mayor, who has been supportive of female traders in the municipality of Cocody for 2 months, from March to April. He has exempted us from any tax, so we didn't pay any tax for 2 months. And I would like to seize this opportunity to thank the President of the Republic of Côte d'Ivoire, His Excellency Alassane Ouattara, and who also has been helping the eligible co-ops, or provided the support funds for these various cooperatives to be able to get out of the rut. So it was not total, but that was my input. Thank you very much. Thank you, ma'am, Mr. Chair. That was quite insightful. Well, anytime we are discussing with field operators, we are always learning. Truly, when we consider a city like Abidjan, with these large communities and districts, you see, closing down the city in terms of access and compared to the remaining parts of the country, it is quite challenging. What does that mean? It means that you need to have food, long-standing or long-term, let's say, food stocks, and that's not self-evident. Definitely, this will, let's say, cause price to rocket. So in Niger, in Niamey, the capital city was quarantined, and people realized more or less they were fending for themselves to feed. It was quite unbearable. So that is quite interesting. Okay, now we are going to move on to the next panel member, the mayor of Bafoussam, who is going to share with us what was the impact of that disease, and how did the local solution identify local solution. Honorable Mayor. Thank you, Doc. I am the mayor of the city of Bafoussam. First of all, I would like to thank OUEHI and the chairperson who has invited me to this event. I have to say that after the other panelists and my fellow sister, starting from March 2020, almost all African countries facing the pandemic took a number of measures which in the beginning were used to curtail the spread of the disease. But very quickly, these measures impacted adversely all business lines, like let's say commercial operations. Bafoussam is the third city of Cameroon. We have a population of 1.5 million population. We have 3 districts, and you have a mayor of community and municipality. But as a whole, the city has 4 large markets, which includes about 10,000 traders. And Bafoussam and is also an agricultural pool, or the first one of Cameroon. And this is an area where you have a lot of market gardening products and foodstuff. And the production, the produce of Bafoussam is helpful to serve other metropolis and neighboring countries. So you understand that the situation created by COVID-19 protocols and had adverse impact. In the early days of the pandemic, a number of action was taken by the government, and these were drastic measures which aim at cutting off the spread of the virus. These included the border closure and the regulation of people traveling in places of large urban concentration. You need to understand that trade, by essence, is the meeting of people, and when this flow of person is cut down, definitely it will have some negative impact. So the typology of commercial activities in Cameroon are as follows. Cameroon is agriculture oriented, which is the main, let's say, growth driver for the country. 50% of the population is involved in agric. And this dynamism in the field of agriculture and is materialized in the force of, let's say, food self-sufficiency. However, when it comes to the case of the town of Bafoussam, its community of traders, we have over 1 million of, let's say, chickens, and it was forbidden to celebrate funeral ceremonies. And this is based in Bamileke, and marriage ceremonies were stopped. So the first victim were the cattle, the poultry farmers. They could no longer sell off the product. Those who have, let's say, purchased chicks, they were able, they had to kill them. And those who had just 10 days, they had to slaughter them because it was no longer useful to feed them. Another sector which has been widely impacted is the producers of marketing and gardening products like tomato. We could no longer sell them to Guinea, to Conakry, and in the city there was a severe slowdown of activity, as was said by my sister. One of the action taken by the government was to close down market. If we close them down completely, how would the most vulnerable segment of the population be able to supply themselves? Or if they have some food stock, they can, let's say, stand for something. What do we do for others? So that is why we said the market should close down at 4 p.m. So the mayor office has to, let's say, disinfect the markets. And that is why the following day, starting from 7, people will come and make purchases. In other cities like Douala, in the large market, they have, let's say, half-time sales. So some cities try to break down the activities. Those who are selling food stuff do it from 6 to 4 p.m. and in the afternoon, those selling other material or commodity could open. This is how across the country, each town with their own specificity, people try to adjust with the situation. And this pandemic created, let's say, a glut of products, but with the destruction of stock, now there was shortage of product. In the early days, there were an overglut of product, but sometime later, some product became scarce, and the supply sector became irrelevant because people had done their best to supply towns and cities. These crises disturb the business pattern and also the consumption pattern, in order to achieve the decrease in the turnover. The traders have also revised downwards their activities in order for them to be revamped. This approach was supported by the Cameroonian government, who since April, having noted the adverse impact of its actions, began to come up with, let's say, more flexible measures. There was a need to know whether they have to impose, let's say, complete lockdown, and so the municipality were told no longer to collect rental expenses from shops, and some local taxes also were, let's say, removed for 6 months.
Les places dans le marché afin de permettre,
and so that this will enable farmers to, let's say, lift up their heads. And then they began to experience, after let's say some progress based on online sales, these enable the traders to diversify their sales method and to come closer to the customer base. There was also an opportunistic economy that came into being. So there were some, let's say, traditional manufacturing unit of facial mask, and without forgetting traditional pharmacopoeia, we try to identify clinical solutions, and also many laboratories came up with some medical solutions. So in Cameroon, 3 products have been endorsed by the Ministry of Health to fight COVID-19 in the face of this situation. So the Association of Municipalities of Community of Cameroon have advocated to the government and for the government to be supportive. So most of the taxes had got down, and it was also discontinued. So that is why they had to advocate with the government and to protect the most vulnerable and companies, for them to be revamped, because if all of them collapse, they will no longer be able to play their role vis-a-vis local population. So due to the stoppage of the partial discontinuity of activities and the scarcity of raw material, and required the support of the government in order for people not to, let's say, go bankrupt. And therefore the government provided some benefits to let's say small and medium businesses, and the municipalities were also promoted to establish smart cities. If we can find something positive, is namely the use of ICT, and working from home is increasingly encouraged, and the various companies have to set up digital equipment. In terms of the way forward, it is important to keep on sensitizing people. We are realizing increasingly that governments are imposing immunization, and today you cannot travel to let's say be vaccinated or to produce a negative COVID test result. So mass vaccination should be encouraged to the population or traders for them to continue doing business. In summary, Corona has not impacted the health sector. The economy suffered a severe shock as a result of WHO and the government measures, and it has destabilized society and especially business activities. However, they have identified some options to adjust with the development online. Though a number of businesses cannot, let's say, rise up because of lack of financial resources, hence the advocacy for the government to be able to take action. And also the population should buy in the vaccination drive. Thank you very much for your undivided attention.
L'innovation dans la fabrication médicale.
Yes, that was a good example of innovation in the preparation of medicines. This is a good example of innovation that should even be promoted in the OEDP's network. Now the last panelist, That is Dr. Bouadi from the Lorougnon Guédé University. So, Mr. KOFFI, could you share with us your perception of the COVID-19 impact on the commercial activities in urban area, and what can we learn from that situation? Thank you, sir. From the early moment of the pandemic at the Lorougnon Guédé University, we took serious measures. The first thing we did was to conduct a survey on the impact of the pandemic on the commercial activities in the city of Daloa. Daloa is the third major city of Côte d'Ivoire after Abidjan and Bouaké, based on the size of the population. So, at the early stage of the outbreak of the pandemic, we've conducted a survey on the impact of the pandemic on commercial activities in Daloa. During that survey, we noticed that at the end of each interview, people said that the government was doing too much for this small or insignificant disease. We told them, well, it's true that we are conducting a survey on the impact, but the survey was also to understand, to see to which extent people knew about the coronavirus. So now, regarding the impact, there was a decrease of activities, not only in Côte d'Ivoire, but as elsewhere in Africa. During the confinement from March 19 to April 29, all the business and workers had to stop their activities. 29% of them had to stop their activities totally. And for 69% it was a partial decrease or partial stop of the activities. So during the first week, 17% of the activities had stopped and 70% were still running the activity, but at a very low level. The operators were confronted to four major challenges. The first challenge was to cover the expenses like rent, water and electricity bill, salaries. The second difficulty was on the reimbursement of the loans that had been taken. The third challenge had to do with how to store the goods. And the fourth challenge was on the selling of the products. So the pandemic has led to a significant decrease of the sale. We've also seen that about 95% of the operators have experienced a severe loss and a significant decrease in the activities. So from 15 of May, these measures were partially removed, yet the activities have not gone back to their previous level. Now the next question was to know the level of awareness of the population regarding the COVID-19. Doing this, we noticed that 67% of people didn't have a good knowledge of the causes of the pandemic. When they were asked about the causes of the disease, they said it was a punishment by God or a curse. So when we made an analysis based on sectors in the town, we realized that the areas of the city where they had a good knowledge of the disease were areas where activities were not resumed easily. In other areas of the town where the disease, the causes of the disease were not well known, very fewer activities were stopped, which means that in those areas where there was a poor knowledge of the disease, people easily shifted to other activities. So this is the contribution I wanted to make. Thank you. Thank you very much, sir. The negative impact of COVID-19 doesn't spare any neighborhood or any city. This shows the resilience capacity of the populations. I think your survey was very interesting. Maybe it would be good to share your findings with us so that we can disseminate it in the network and give a better knowledge of this situation to everyone. Now, I'm going to give the floor to the audience for contributions or input or questions, if any. Good morning. My name is Akitaku Dieng. I'm coming from Mauritania. I'm from the civil society. I'm leading an organization that is so I was saying that I am from the civil society. I'm leading a civil society organization, an NGO that is working on citizen participation. I first of all want to commend the panelists for the brilliant contribution they have made. Anytime we speak about COVID-19, I feel like saying that the impact of COVID-19, I mean, it is interesting to speak about the impact of the pandemic on the capacity or the resilience of women. We know that, generally speaking, everyone has been affected. But you agree with me that women have been more affected. My request is to urge the researchers attending to focus on that aspect. I mean, the impact of the pandemic on women, because when I heard the contribution of the lady in the foodstuff sector, she explained how women have been affected both in urban areas and in rural areas where we could hardly realize or take the right measure of what has been experienced by women in rural areas. You know, women, whatever the sector where they are, have been severely affected by the pandemic. So I will urge the researchers to also focus on that aspect. Thank you. Behind you, we have another participant who wants to say something. Thank you. Ladies and gentlemen, it is true that the economic aspect is the one that has been highlighted. I am Mrs. Queen Cecile, Director of Social and Sanitary Services at the municipality of Port-au-Bouet. I was saying that the economic aspect has been emphasized by all the panelists. That is true. At the municipality of Port-au-Bouet, the dressmakers, you know, from the beginning, everyone was asking for hand sanitizers or face masks, everyone. So what we did was
d'acheter les masques, parce qu'il n'y en avait même plus, il y avait une pénurie, donc il y avait une surenchère.
Well, so the mayor decided to gather all the dressmakers of Port-au-Bouet. We went to the headquarters of the WHO at Abidjan to ask them if it was recommended to make our own face masks with fabrics. They said it was not recommended, but still the mayor decided to do that, and he gave a contract to the dressmakers of Port-au-Bouet to make masks, face masks in fabrics, and it was a good contract for them. So the production of face masks was then taken by the municipality and distributed to different communities and populations. We also bought buckets that were used for hand washing. Women were also requested to make soap. Another aspect was that markets were closed, but in Port-au-Bouet, because those markets were closed at a given time, we took that opportunity to wash the markets during the times of closure, and you know, it was a very important operation which permitted those markets to be cleaned and to be so this was a contribution to the improvement of the working condition of those sellers. Thank you. Thank you, madam. Who else has something to say? Yes, please. My name is Kosia Anzara, and I am here as a member of civil society, but I'm also here as an anthropologist. My question is to the lady in the sector of food stuff. In your sector, you have seen the amount of loss. Now, what are the measures you have? What are the measures to take in case we have a similar situation in your sector? Do you have any initiative for the processing of our food stuff or commodities? Well, here, the lady. Good afternoon. I am Mrs. Megwe Adelaide, Vice Chairperson of the Association of Market in Cocody. I want to say thank you for this initiative. We, the ladies of Cocody, we really want to commend our mayor because he is the chairperson of this organization. We also want to say that during this pandemic, he didn't spare any effort for his population. He was always watching, making sure that there was no shortage of food in our markets. It was not easy, but he was still standing by our side, cleaning all the markets of Cocody. There was also one initiative where some vehicles were provided. He distributed hand washing devices. He has also mobilized the vehicles for in order to facilitate the mobility in the market. It was important for me to highlight it, and I want to commend the administration of the municipality, mainly the mayor. This is the kind of mayors that we want for the population. Women are ready to work. You know, women are mothers. They are used to working very early in the morning for the benefit of their families. So we really want to say thank you for this initiative, and thank you to our mayor, Mr. Yasse. Thank you. Madam, you are in the heart of this topic. It is about democratic participation. We've been talking about it. You know, even though you are an elect, you always have to go back to the communities because you are working for them. When the lady was speaking about the face masks, I was smiling because I am in Morocco. When it was announced that wearing face mask was compulsory, it was funny to see how people were assaulting the pharmacies. And in Europe, we heard about ships carrying face masks products that were being diverted from their destinations. No other contribution in the audience, so I give the floor back to the panelists. Madam, there was a specific question for you. Thank you, madam, for your question. It is true. I spoke about the loss that we have experienced during the COVID-19 pandemic, and we are not going to keep on doing the same thing or doing things the same way. We have to think about processing. But you know, processing is a big topic that requires a lot of means, because the necessary equipment has a cost, you know, and it is not something that a small seller can do. So since you are raising this question, I take this opportunity to ask entities to help us. Entities like banks, because as women we have a culture of reimbursing what we borrow. So please, if you are a bank or a financial institution, we need your help. We need your help, and I'm not talking about Côte d'Ivoire only, but anywhere in the world, people need this assistance. You know, as an organization of producers of foodstuff, we noticed that during the pandemic it was very difficult to sell our products, and it's a real pleasure for me to say that our organization is one of the only organizations in this sector to be connected, so that we were able to sell our product online. Thank you, madam. I think you addressed the question properly. Now, our friend from Mauritania raised a very specific question. Maybe you could focus on women, the impact of the pandemic on women. What do you think? What do you have to say about that? Your point is very relevant, and we have even conducted a survey on the impact of COVID-19 and women on COVID-19, not the impact, or how much people knew about the pandemic, and we discovered that women were among those who had very few knowledge, and these women they didn't know much about the pandemic. And there are ongoing surveys, like I told it to a colleague, the real solutions should come from ladies and for ladies and women. So thank you for your suggestion. Thank you, Doctor. Now, Madam Mayor, you heard the questions and contributions. Do you have any thing specific to add? Thank you, Mr. Moderator. I think that the pandemic is not about to end, and I think we still have quite sometimes to be with it, and we have to know what to do in order to avoid our countries and communities to collapse in poverty. Many of our communities are already in poverty to different extent. I want to commend Côte d'Ivoire through Abidjan for showing an example of development. But I just want to ask women and the youth to develop local solutions in our communities, on our territories, because we cannot today ignore what is happening around us. It is true that it is not easy, because today it is difficult to meet, even to organizing conferences. Conferences are done by online. We have e-commerce, e-banking, everything is done online. It is true that digital is important, but sensitization is also important. Many people do not know what's happening, and the more we tend to ignore it, the more we are leaving people in their situation, because everybody is busy doing other things. Commerce is important. Foodstuff exploitation is important. In Cameroon, we've been through very special situation. Tons of commodities was thrown away because it was rotten. We have to think about local solutions, as the lady was saying it. The industry should be developed, even if it should be small industry. This should be developed. We should find solutions of processing our commodities so that our producers do not starve. It is complicated. It is a complex issue, and decentralized or local collectivities should show more commitment, because the mayor of Cocody has just been commended for developing efficient solutions for the populations. In Cameroon, I would say that we are assisted by the government, but it is not enough, because the government doesn't have the capacity, financial capacity, to assist everyone. So we have to develop our own solutions in our communities so that the economic development that we are expecting can be relevant and appropriate. Thank you, dear Mayor of Bafoussam. Thank you.
Indeed, we need to come up with solutions. In our place, we just set up a project to build a plant to slaughter and preserve poultry. We are trying to identify financial sources. Territorial communities now have free hands to identify external funding based on some conditions. The government needs to know who is going to be our let's say donor. Formerly we used to have avian flu, and also all the farmers had been faced when it was also the pig flu. It was the same thing. Today with COVID, they have suffered the same problem. So we said that we need to set up a local let's say location of slaughtering and conservation of them with a reefer container. We will make sure that animals are well protected and there will be, let's say, conserve for as long as possible. Then people will no longer destroy poultry. Some years ago, in the Fumbob region, the government set up a plant to preserve tomatoes. Unfortunately, it was a white elephant. Unfortunately, we think that territorial collectivities, communities, as part of participatory democracy, should involve the local population. As Madame said, the community can create something within which the traders are stakeholders, and they are here to the mayor office will stand as surety, and in order to build that kind of plant. And if everyone find a solution alone, it will not be possible. And you see, even the banks, they don't want to grant loans to private individuals. For instance, the insurance people didn't want to pay if people died as a result of COVID. So the supervisory regulator, even you have to pay. So the bank are quite scarce to grant loans to private individuals. But with the support of the municipalities, it can be done. To come back to what I've said, in July 2021, and some projects have been endorsed by the government, so people know that our product, the Archbishop, Metropolitan Archbishop, is a natural therapist. He developed a product that can fight COVID efficiently. Thank you, Mayor. I would like to bring a small contribution. We spoke about network. I think that it is very important when you talk about let's say solidarity economy. So we need to have a people-oriented economy. So through the development of cooperatives and the structuring, you can work as a group, as part of our community. People used to work on their own, and today you can no longer have something, and these are the groups which are developed today, and the government should approach also multinational. Once you are working as a group and in the form of co-ops, and we develop things within the communities, and we call them and relays. This is a social and solidarity economy at the social level, and there are some women who grow cassava, and you can place order by the government, and we are talking about also dressers, let's say the sewers. You can go to, let's say, the workers or laborers, and to even infirmaries. They are also organized as cooperatives, like hotels. In big countries, they have become developed. Let me take the example of Brazil and even France. They are developing social and solidarity development from the grassroots. And I think this is where the salvation of Africa will come from for sustainable development. Thank you. Mrs. Mayor.
Attention, il y a une prochaine session, on nous demande de libérer la salle. Donc je ne sais pas, oui, si vous avez quelque chose vraiment rapidement en 1 minute. Il y a un micro là, mais rapidement s'il vous plaît, parce que nous devons libérer la salle. Oui.
Bonjour, messieurs, dames.
Oui.
Je m'appelle Marie-Jeannette. Je suis membre du bureau politique du PDCI.
A member of the political party and boards called PDCI, so I don't know whether you are vaccinated, but you are not wearing any mask. I'm talking about the panelists. Are you immunized? My concern is to know for how long can we wear the mask? For how long? We can wear for 3 months since we are not informed about the length. Because in the rural areas, you can have a mask for the whole year. If my mouth is smelling, it's my own mouth, no problem. So this is one of the concerns. In actual fact, what do I mean? Sensitization is done superficially. That's what I observe. In actual fact, we are not informed about the steps to take in order not to contaminate or not to contract COVID. And they say now COVID. So thank you very much. The discussion can continue after. We are going to stop now. Please give a round of applause to the Honorable Mayor. And I've been asked to inform the next session that it is at Salle des Fêtes. That's what I was. Okay, good afternoon. Thank you very much.